Engineer Ugoji, a 2007 graduate of American International School of Medicine with 10 years of clinical experience working as a certified nurse aide at various hospitals, long-term acute care facilities, nursing homes, with patients in their private homes, from doing my clinical rotations here in the United States, from 2 graduate medical education programs, Henry Ford Internal Medicine Residency Program, Detroit, Michigan, and Springfield Family Medicine Residency Program, Springfield, Illinois, from various observerships and externships, and also from my preventive health care at various charity works and also at various community churches, with a master's in business administration with an emphasis on public administration from Davenport University, Grand Rapids, Michigan, and with research experience from UT Southwestern Psychiatry Department, working with Dr. Carol North and Dana Downs, who are both awesome people. And I'm currently involved in preventive health care at my preventive health care practice, Dr. Chiquito Mentoring Preventive Health Care Practice, and also applying for residency this year. And I want to welcome you all to Dr. Chiquito Mentoring Ustream show, where we are always learning. This show was designed to be able to help healthcare professionals, physicians, nurses, residents, and to talk about a health topic every day, which we commonly see on rounds, in our clinics, as we go through residency training, and even as patients too, to be able to help us to learn how to figure out the symptoms that we actually see in various diseases, to be able to come up with differential diagnosis, what it could be, and also with a definitive diagnosis of what that disease is. We've actually talked about lots of topics previously, and this week we have a lot of interesting topics lined up. We'll talk about Croup, we'll talk about bronchiolitis, we'll talk about septic arthritis, we'll talk about dysfunctional uterine bleeding. So all these are interesting topics that we'll talk about. And I have a Powerball question designed to help us to understand these topics, and to help us to motivate us to be able to read the article, so we can be able to come up with answers of those Powerball questions. And if you answer the questions correctly, you actually get to win a prize. We have lots of prizes from our sponsors, various great medical education programs, and other organizations which are on my website. And I want to invite you to check out those organizations, and also take a shot at the Powerball question. The drawing will be done on Saturday, where I'm going to be doing some Zumba dancing, teaching us some Zumba dancing, which is a very wonderful part of the Latin culture, something I picked up as a hobby. And also talk about my various charity works, and I want to invite you to be able to check out the timetable on my webpage. And then also we'll talk about residency interview questions. I'm pretty the countdown for the March has actually begun, and I'm pretty sure that most of us have actually gone through some of the of our residency interviews. And I want to invite you to share some of the experiences that you have experienced as you have gone through your residency interviews. And then also, and every day, we'll talk about a residency interview question, and it's designed to be able to help us to be able to gear us for answering questions that we encounter during our residency interviews. So today we're talking about Croup, and I'm gonna read the Powerball question, and then talk about the case study, and then talk about the topic Croup. And our residency interview question of the day is, do you think you can be able to manage your personal and professional life to be able to become a balanced and competent resident? Our featured residency program of the day is Mercy Internal Medicine residency program. So the power question for today is, Croup is more common in boys than in girls. Well, if you know the answer to that, feel free to post on my social stream on my social media, and we can be able to be in line to win one of the Powerball prizes. So the case study location, it's an emergency room. Vital signs, temperature 38.0, respiration 30 per minute, blood pressure 101/68. Heart rate is 90 per minute. The history of present illness. The patient is a 20-month-old male who is accompanied by his mother, who provides the history. This patient began to get ill 2 days prior to coming to the emergency room with a runny nose and mild cough. The mother reports that she thought he had a low-grade fever because he felt subjectively hot. However, she did not take his temperature. The patient has continued with his regular activities and is eating, drinking, and urinating as usual. However, on the evening of presentation, the patient began to have a more severe harsh barking-like cough that has increased in severity over the past 10 hours. The patient has become increasingly hoarse, and according to the mother, noisy breathing. Review of system is negative except for some complaints of sore throat, although it's difficult to determine because of the patient's age. The mother denies the patient getting into any small objects which he may have ingested. So this patient has a runny nose, he has a mild cough. These are upper respiratory tract symptoms. He also has a fever, and then also he also has hoarseness and also noisy breathing, and also a sore throat. So these are all symptoms that this patient has, and I'm sure at this point you're thinking about some differential, some things that it could be. I mean, I'm sure you're thinking that it could be epiglottitis, it could be infectious mononucleosis, it could be spasmodic croup, it could be laryngeal web, it could be tracheomalacia, malacia, it could be laryngeal papillomatosis. So it could be influenza. These are the top things that you might be thinking it could be, but hopefully at the end of this presentation, of this show, we can be able to know why it's croup and not any of those differentials. So croup, I'm going to talk about this topic, and I want to invite you to check out the article on my webpage, which talks about croup. And our goal today is to learn what croup is, how common it is, what causes it, what are the risk factors, what are the differential diagnoses, what are the signs and symptoms. The diagnosis, how do we diagnose it in terms of labs, laboratory orders and imaging. How do we treat it in terms of medications and also other non-medication treatment, and also how do we prevent it, and also how do we code it in our clinics and also in the hospitals. What is croup? Well, croup is actually derived from the Scottish word for raven's croak. So it's actually a derivation from the Scottish word raven's croak. It's a common, primarily pediatric viral respiratory tract illness, and it's also called laryngotracheitis or laryngotracheobronchitis, and affects the larynx, the trachea, and also the bronchi. It's the most common etiology for hoarseness, cough, and onset of acute stridor febrile children, and the vast majority of children with croup actually recover without any sequelae or any residual symptoms, and that's from an article from DefenDG 2013. So how common is it? Well, in terms of epidemiology, the male to female ratio is 1.4 to 1, and it's more commonly diagnosed in boys than in girls. The overall incidence is 6 cases per 100 children less than 6 years, and hospitalizations 1 to 15% of US cases. That's 20,000 per year. And intubation, 1 to 5% of cases hospitalized. That's from an article written by DefenDG 2013. So what are the causes of croup? Well, parainfluenza virus type 1, that's in 18% of cases. Parainfluenza virus types 2 and 3. Adenovirus, respiratory syncytial virus, influenza A and B, rhinovirus, enterovirus, mycoplasma pneumonia, which is quite uncommon. So what are the risk factors? Well, if the child attends daycare, if the child is 3 years or younger, if the child has a history of croup, if the child has a family history of croup, if the child has frequent upper respiratory tract infections, and then also during colder months like during October through March, which we are in right now. then that's a risk factor for croup. Then, in terms of differential diagnosis, what else should we think it should be if we see a patient that has all these symptoms? Well, it could be epiglottitis, it could be laryngeal malacia, it could be a laryngeal web, it could be laryngeal papillomatosis, it could be infectious mononucleosis caused by Epstein-Barr virus, it could be influenza, it could be subglottic stenosis, it could be angioedema, it could be an allergic reaction, it could be angioedema like we talked about, it could be uveitis, it could be vocal cord paralysis, it could be innominate artery compression, it could be right aortic arc vascular ring, it could be double aortic arc, it could be aberrant subclavian artery, it could be pulmonary artery sling, airway foreign body, brachial tracheitis, diphtheria, epiglottitis, inhalation injury, laryngeal fractures, measles, and peritonsillar abscess. So it could actually be viral in etiology, could also be congenital too. So what are the clinical presentations? In terms of symptoms, fever, which this patient had, coryza, which precedes the symptoms by several days, and upper respiratory tract infections, hoarseness, which this patient also have, and a cough, which has been described as barking or seal-like, inspiratory stridor, expiratory wheezing, dyspnea, symptoms that are worse at night, symptom duration less than 1 week, which peaks at 1 to 2 days. In terms of signs, mild to moderate respiratory distress, bring up my slides here, and mild wheezing. Diagnosis, so that's, and that includes laboratory orders and imaging. So in terms of laboratory orders, a complete blood count is actually indicated, and most of that time, and with differential, and most of the time, it actually shows mild leukocytosis, and that's actually to rule out any infections. And in terms of imaging, a neck X-ray is indicated, and that will actually show subglottic narrowing, which has been described as a staple sign on PA neck X-ray, and that's in 40 to 50% of croup cases. And then also narrowing of subglottic region from mucosal edema. So how do we treat croup? Well, home therapy includes maintaining adequate ambient humidity in the house, which may decrease subglottic edema and may make asthma worse due to irritation using cool mist humidifier. So it actually helps the symptoms of croup, but it actually makes asthma worse, especially if the child has coexisting asthma. And then in cold weather, bonding the child and bringing the child, and keeping the child outside for 15 minutes has actually been shown to help. Also, placing the child in a closed bathroom with a cold shower mist has actually been shown to also help too. It's very important to maintain adequate hydration. So you have to offer the child his or her favorite hydrating drink every 10 minutes. So that includes like ice drinks or other frozen drinks. In terms of medication, corticosteroids like dexamethasone, humidified oxygen, nebulized racemic epinephrine, and antibiotics has been shown to help. Helium added to oxygen may prevent intubation in borderline patients. Procedures, intubation may actually be needed, but it's indicated less frequently with above management due to the significant risk of subglottic stenosis. It causes subglottic stenosis, so that's why we actually try to prevent that. But if we have to intubate, it's advisable to use an ET tube at least one size smaller than predicted. So how do I prevent croup? Prevention, well, frequent hand washing is very important. And then also keeping your child away from any sick contacts. That includes daycare, that includes any close contacts who have any viral or any other bacterial illness. And then also immunization too. Keeping your child up to date on his or her immunization is very, very important. The diphtheria, hemophilus, influenza type B vaccines offer protection from some of the rarest but most dangerous forms of upper airway tract infections. So some important points include outpatient management indications. When do we decide to let the child go home? Well, if they have a non-toxic appearance, if they are well hydrated and taking oral fluids, if they have minimal or no stride or retractions at rest, at presentation or 2 hours after epinephrine, if the parents are reliable, then at that point you can make that clinical decision to be able to discharge them, and have them follow up with their primary care or pediatrician physician. And then for inpatient observation indications, if they have any signs of respiratory distress or respiratory failure, if they have cyanosis, if they have tachypnea, if they have agitation or fatigue, if they have very severe stridor, if they are using the accessory muscles of inspiration, if they're using their intercostal muscles, if they're using their neck or abdominal muscles, if they have rising arterial PCO2, then that's when you actually decide to admit them. And then immunization against Haemophilus influenza type B has actually contributed to the decreased incidence of epiglottitis, and the early use of corticosteroids has decreased the incidence of respiratory distress in patients with croup. That's from an article written by Zurub et al. 2011. Coding and billing, ICD-9 464.4, ICD-10 is J05.0. So this patient actually has croup, and that's the final diagnosis. So I have a Powerball question, which I talked about earlier, and I'm going to read it again. And if you can take a shot at that, you can be able to qualify to win one of the Powerball prizes from our sponsors. So the Powerball question is, croup is more commonly diagnosed in boys than girls, true or false? So I have the answer to that on my web page, and if you can be able to answer that question, you can be able to qualify to win one of the Powerball prizes. So I want to encourage us to read the articles which are the references. Defending G 2013 Croup, Family Practice Notebook, 2013 Croup, Zurub et al. 2013 Croup, an overview, that's from the American Academy of Family Physicians, and also the etiology of recurrent croup from the American College of Physicians 2013. So check out those articles, and they're very, very, very useful. And also want to encourage you to read the article on my webpage too. So at this point, we'll go to the residency interview question of the day. We actually past the preventive health topic of the day, and I want to encourage us to share our residency interview experiences. So the question of the day is, will you be able to do you see any problems managing a professional and a personal life? We've actually answered lots of residence interview questions previously, and this is a very important question that most residency programs want to, might ask, to be able to know if you are all set for the next step in your career, which is residency. And it's a question that is aimed at knowing if you have a plan in place to manage your professional and personal life. And in terms of that, they want to know what plans you have in terms of marriage, in terms of divorce, in terms of daycare, finances, and other parts of your personal life, and also integrating all of that to become a balanced and competent resident. Some questions about marriage and divorce are actually not asked at residency interviews, but most programs might actually ask that because they want to be able to know whether you have a plan in place, and to be able to know what what stage in your life you're in, and if you're able to integrate all of that into becoming a competent resident, because that actually affects your ability to become a competent resident. So a good answer to this question includes I think I'll be able to integrate my personal and professional life to become a competent resident by integrating my personal life, which for me means my family. I'm actually currently working on a divorce, which is almost final. I have a 2-year-old son, daycare. He goes to kinder care, which is actually a very awesome child care facility here in the Dallas metropolitan area. My social life, which includes various charity walks, Zumba dancing, and also my preventive health care practice, where I offer free health care to various community churches and also at various charity works. My finances, which has actually improved by doing the Masters in Business Administration at Davenport University, and also introduced me to the role of administration in healthcare, and also and then also other parts of my personal life, and integrating all of that to become a balanced and competent resident. So this is actually what most programs want to want to know, and and that's a sample answer to that question. So I want to invite all of you to get to share your residency interview experiences, and to help us to prepare for residency interview. It's a very exciting time in your career, and it's you actually get to meet lots of people, to be able to get an insight into how you are going to spend the next 3 years of your life to become a competent resident. So I want to invite all of us to share our residency interview experiences. And you can do that by posting on my social stream, by sending me an email, or by calling me. And at this point, I want to talk about our residency program of the day, which is Mercy Hospital and Medical Center Internal Medicine Residency. It's located in the Chicago metropolitan area. I'm going to talk about the structure of the curriculum. So they have a broad base of experience with a strong emphasis on primary care in the outpatient setting, and that includes acupuncture, adolescent medicine, allergy and immunology, anesthesia, anticoagulation clinic, behavioral medicine and psychiatry, cardiac stress testing, community medicine, dermatology, diagnostic and interventional radiology, general surgery, geriatrics, gynecology, HIV clinic, minor emergency care, neurology, occupational medicine, office management, ophthalmology, orthopedics and cast room, otorhinolaryngology, physical medicine and rehabilitation, podiatry, rheumatology, sexually transmitted disease clinic, urology, wound care clinic. The weekly conference schedule, on Mondays, 12 p.m. they have a lecture on financial talk. On Tuesday by 1 p.m. they have a conference on allergic rhinitis by Dr. Muni Yapa. And then by 12 p.m. they have cardiology for seniors by Dr. Dizadji. On Wednesdays by 9 p.m. they have intern report. 12 p.m. they have chronic kidney disease by Dr. Kat Palia. On Thursday they have case conference. On Friday they have grand rounds in the morning, and then by 12 p.m. after lunch by 1 p.m. they have thyroid diseases, a lecture on thyroid diseases by Dr. Rusik. So that's a sample of the weekly conference schedule. So and the above listed ambulatory experiences take place over 4 months of the residents' 36-month training cycle. The size of the program, they have 16 residents. The application information, they take applications through errors. And I have actually interviewed there. And some of the interview questions that I recall being asked include, tell me about yourself, which I have an answer to that on my webpage. We've talked about that previously on the show. And then also a case presentation on asthma exacerbation. And I have a topic on asthma exacerbation on my webpage. So the strengths of the program, they combine the advanced capabilities of a major urban medical center with the humanistic focus of a community-based hospital. They have a diverse and challenging primary care setting, a well-rounded academic program, and a highly qualified teaching faculty which are board certified and have clinical appointments at the University of Illinois College of Medicine. They also have a long-standing commitment to medical education and success of their graduates. They are located at Mercy Hospital, 2525 South Michigan Avenue, Chicago, Illinois. The program director is Dr. Stephen R. Potts, DOFACP. The program coordinator is Margie Miller. And you can be able to contact them via their webpage and also by their phone number, and also apply through errors. So I want to invite all of us to share our residency interview experience, and also I want to thank Mercy Hospital Internal Medicine Residency for the mouse pad, which is part of the Powerball prizes that we can be able to win if we answer the Powerball questions correctly. And with that, I also want to talk about some of the things that we offer on Dr. Chiquito Mentoring Preventive Care Practice, and that includes free healthcare at various charity organizations, at various community churches, and also home visits too. And then we also offer counseling for victims of sexual and domestic violence, which is something a passion of mine, and I have actually talked about that at various at a local community church. And also we're also part of Towers, which is actually a project by the American Academy of Family Physicians, a smoking cessation project, and it's designed for middle school students to come up with a design that is designed to encourage adults to be able to stop smoking. And every year at conferences which are held every year, some winners actually picked out, and they get a shot at winning prizes. So this week I'll be going to 3 middle schools on Wednesday to be able to talk to them about it and to present this to them, and hopefully we can be able to come up with some middle school students who are going I'm going to be able to take a shot at creating these posters. And I also collect donations for Light the Night Walk and 8 Walk South Dallas, which are charity walks which have all ended for this year, but will take place next year. And all that information can be found on my webpage with pictures from previous walks that I've been part of. And then also I also do Zumba dancing on my show every Saturday. So I want to thank everybody who has logged into this Ustream show, or who has who takes out the time to watch this video. And I want to encourage you to take a shot at the Powerball question, which is actually designed to help us to get an understanding of these topics. And the drawing will be done on Saturday by 5 p.m. and a winner will be picked out. So with that, I want to thank everybody once more, and I want to wish you a wonderful day, and to encourage you to log in for tomorrow's Ustream show on bronchiolitis.